Welcome to this comprehensive Nclex practice session on fluid and electrolyte balance, one of the most tested areas in nursing examinations. In this session, you will challenge yourself with 50 high-yield questions, each followed by clear answers, rationales, and strategies to strengthen your understanding. Stay with me till the end to test your full mastery, and when you're done, comment your score below to see how well you performed compared to other learners. Question 1. A client receiving diuretic therapy for hypertension reports muscle weakness and irregular heartbeats. Which electrolyte imbalance is most likely? A. Hypernatremia, B. Hypokalemia, C. Hyperkalemia, D. Hyponatremia. Answer B. Hypokalemia. Rationale. Diuretics often cause potassium loss, leading to muscle weakness and cardiac dysrhythmias. Strategy. Always assess cardiac rhythm when potassium levels are abnormal. Question 2. A client has a serum sodium level of 128 milliequivalents per liter. Which finding should the nurse expect? A. Dry mucous membranes. B. Decreased urine output. C. Confusion and seizures. D. Increased thirst. Answer C. Confusion and seizures. Rationale. Hyponatremia causes cerebral swelling and neurologic changes. Strategy. Prioritize neurological assessments for sodium imbalances. Question 3. Which IV fluid is isotonic? A. 0.9% normal saline. B. 0.45% normal saline. C. 3% normal saline. D. D5W after infusion. Answer A. 0.9% normal saline. Rationale. Isotonic fluids maintain equal osmotic pressure, preventing fluid shifts between compartments.
Question 4. Which ECG finding indicates hyperkalemia? A. Flat T waves. B. Peaked T waves. C. U waves. D. Prolonged QT interval. Answer B. Peaked T waves. Rationale. Tall, peaked T waves are classic indicators of hyperkalemia. Question 5. A patient who has been vomiting for 3 days is likely to develop A. Metabolic acidosis. B. Metabolic alkalosis. C. Respiratory acidosis. D. Respiratory alkalosis. Answer B. Metabolic alkalosis. Rationale. Gastric acid loss from vomiting causes increased blood alkalinity. Question 6. Which calcium level indicates hypocalcemia? A. 7.4 milligrams per deciliter. B. 8.8 milligrams per deciliter. C. 9.2 milligrams per deciliter. D. 10.4 milligrams per deciliter. Answer: A. 7.4 milligrams per deciliter. Rationale: normal calcium levels are 8.5 to 10.5 milligrams per deciliter. Question 7. Trousseau's sign is associated with A. Hyperkalemia, B. Hypocalcemia, C. Hypermagnesemia, D. Hyponatremia. Answer: B. Hypocalcemia. Rationale: carpal spasm during DP cuff inflation indicates calcium deficiency. Question 8. Which condition can cause hypernatremia? A. Excessive water loss, B. SIADH, C. Heart failure, D. Overhydration. Answer: A. Excessive water loss. Rationale: water deprivation increases sodium concentration. Question 9. In the first 24 hours after major burns, fluid shifts from A. Intravascular to interstitial space, B. Interstitial to intracellular space, C. Intracellular to intravascular space, D. None of the above. Answer: A. Intravascular to interstitial space. Rationale: increased capillary permeability causes plasma leakage into tissues. Question 10. A client's potassium level is 6.3 milliequivalent per liter. What is the priority nursing action? A. Restrict potassium-rich foods. B. Place the client on cardiac monitoring. C. Administer potassium chloride. D. Increase oral fluid intake. Answer: B. Place the client on cardiac monitoring. Rationale: hyperkalemia can cause fatal arrhythmias. Cardiac monitoring is critical. Question 11. Which patient is most at risk for dehydration? A. Adult runner, B. Elderly client with fever, C. Child with mild cough, D. Postoperative client with IV fluids. Answer: B. Elderly client with fever. Rationale: older adults have decreased thirst response and lose more fluid through perspiration. Question 12. A client with prolonged diarrhea is most likely to develop A. Hypokalemia, B. Hypernatremia, C. Hyperkalemia, D. Hypercalcemia. Answer: A. Hypokalemia. Rationale: potassium is lost through intestinal fluids during diarrhea. Question 13. A client on NG suction develops metabolic alkalosis. Which replacement fluid is best? A. Potassium chloride, B. Sodium bicarbonate, C. 3% hypertonic saline, D. D5W. Answer: A. Potassium chloride. Rationale: NG suction removes both acid and potassium. Both should be replaced. Question 14. Which hormone increases sodium and water retention? A. Aldosterone. B. Insulin. C. ADH. D. Parathyroid hormone. Answer. A. Aldosterone. Rationale. Aldosterone enhances renal sodium and water reabsorption. Question 15. Which finding suggests dehydration? A. Bounding pulse. B. Crackles in lungs. C. Decreased urine output. D. Weight gain. Answer. C. Decreased urine output. Rationale. Fluid deficit causes concentrated urine and reduced volume. Question 16. Normal potassium range is A. 2.0 to 3.0 milliequivalents per liter. B. 3.5 to 5.0 milliequivalents per liter. C. 6.0 to 8.0 milliequivalents per liter. D. 1.0 to 2.0 milliequivalents per liter. Answer. B. 3.5 to 5.0 milliequivalents per liter. Question 17. A patient taking furosemide should be monitored for A. Hyperkalemia. B. Hypokalemia. C. Hypermagnesemia. D. Hyponatremia. Answer. B. Hypokalemia. Rationale. Loop diuretics increase urinary potassium excretion. Question 18. Clustic sign is checked by tapping A. Over the wrist. B. Over the cheek. C. Over the clavicle. D. Over the shoulder. Answer. B. Over the cheek. Rationale. Facial twitching indicates hypocalcemia. Question 19. In SIADH, which laboratory finding is expected? A. Hypernatremia. B. Hyponatremia. C. Dehydration. D. Hypokalemia. Answer. B. Hyponatremia. Rationale. ADH causes water retention, diluting sodium concentration. Question 20. A client on TPN develops crackles and dyspnea. What is the probable cause? A. Fluid overload. B. Air embolism. C. Hypovolemia. D. Hypoglycemia. Answer. A. Fluid overload. Rationale. TPN can increase circulating volume, leading to pulmonary congestion. Question 21. Which electrolyte is primarily responsible for cardiac muscle contraction? A. Calcium. B. Sodium. C. Magnesium. D. Potassium. The answer is D. Potassium. Question 22. The nurse notes tinting of the skin and dry mucous membranes. This suggests A. Fluid volume excess. B. Fluid volume deficit. C. Electrolyte balance. D. Water intoxication. The answer is B. Fluid volume deficit. Question 23. A patient with Addison's disease is prone to which imbalance? A. Hypernatremia. B. Hyperkalemia. C. Hypokalemia. D. Metabolic alkalosis. The answer is B. Hyperkalemia. Rationale: aldosterone deficiency causes sodium loss and potassium retention. Question 24. A patient with serum magnesium 1.2 milligrams per deciliter should be monitored for A. tetany and seizures, B. flaccid paralysis, C. decreased reflexes, D. bradycardia. Answer: A. tetany and seizures. Rationale: hypomagnesemia increases neuromuscular excitability. Question 25. Which of the following causes metabolic acidosis? A. diarrhea, B. vomiting, C. diuretic use, D. hyperventilation. Answer: A. diarrhea. Rationale: intestinal fluid loss removes bicarbonate, causing acidosis. Question 26. Which client is most at risk for hypercalcemia? A. client with hypoparathyroidism, B. client with bone metastases, C. client with chronic renal failure, D. client receiving blood transfusion. Answer: B. client with bone metastases. Rationale: bone destruction releases calcium into the bloodstream. Strategy: think bones breaking, calcium rising. Question 27. A patient has serum sodium of 154 milliequivalents per liter. Which IV fluid is most appropriate? A. 0.9% normal saline, B. 3% normal saline, C. 0.45% normal saline, D. D5LR. Answer: C. 0.45% normal saline. Rationale: hypotonic fluids help lower serum sodium by diluting extracellular fluid. Question 28. Which condition can result from excessive use of antacids containing magnesium? A. hyperkalemia, B. hypermagnesemia, C. hypocalcemia, D. hypernatremia. Answer: B. hypermagnesemia. Rationale: magnesium-containing antacids raise serum magnesium levels, especially in renal impairment. Question 29. A patient presents with a serum potassium of 2.8 milliequivalents per liter. Which nursing action is priority? A. Prepare to administer IV potassium slowly. B. Encourage fruit intake. C. Stop potassium-wasting diuretics. D. Increase IV fluid rate. Answer: A. Prepare to administer IV potassium slowly. Rationale: potassium levels below 3.0 milliequivalents per liter can cause life-threatening arrhythmias. IV replacement is urgent. Strategy: never give potassium IV push. Question 30. Which clinical finding indicates fluid overload? A. Flat neck veins, B. weak pulse, C. crackles in lungs, D. hypotension. Answer: C. crackles in lungs. Rationale: fluid accumulation in pulmonary circulation causes crackles and dyspnea. Question 31. A client with renal failure is likely to develop A. hypokalemia, B. hyperkalemia, C. Hypomagnesemia. D. Hyponatremia. Answer: B. Hyperkalemia. Rationale: the kidneys excrete potassium. Renal failure causes retention.
Question 32. A nurse notes a positive Chosveck sign. Which intervention should be anticipated? A. Administer calcium gluconate. B. Restrict dairy products. C. Administer sodium bicarbonate. D. Encourage oral fluids. Answer: A. Administer calcium gluconate. Rationale: a positive Chosveck sign signals hypocalcemia. Calcium replacement corrects the deficit. Question 33. The nurse identifies which as a cause of hyponatremia? A. Excessive sweating. B. Dehydration. C. Cushing's syndrome. D. Diabetes insipidus. Answer: A. Excessive sweating. Rationale: sodium loss through perspiration without replacement leads to hyponatremia. Question 34. Which of the following findings is associated with hypermagnesium? A. Tremors. B. Hyperreflexia. C. Hyporeflexia. D. Seizures. Answer: C. Hyporeflexia. Rationale: elevated magnesium depresses neuromuscular activity, causing diminished reflexes. Question 35. A patient with serum sodium 120 milliequivalents per liter should be closely monitored for A. Bradycardia. B. Seizures. C. Muscle rigidity. D. Jaundice. Answer: B. Seizures. Rationale: severe hyponatremia causes brain swelling and seizure risk. Strategy: always monitor neurologic changes in sodium disorders. Question 36. Which symptom is common in metabolic acidosis? A. Slow, shallow breathing. B. Rapid, deep respirations. C. Cyanosis. D. Bradycardia. Answer: B. Rapid, deep respirations. Rationale: Kussmaul respirations compensate for acidosis by exhaling CO2. Question 37. A client receiving IV potassium complains of burning at the site. The nurse should A. Discontinue immediately. B. Dilute the infusion further and slow the rate. C. Apply a cold compress. D. Increase infusion rate. Answer: B. Dilute the infusion further and slow the rate. Rationale: potassium irritates veins. It should be infused slowly and diluted. Question 38. Which assessment finding indicates fluid volume deficit? A. Jugular vein distension. B. Bounding pulse. C. Orthostatic hypotension. D. Weight gain. Answer: C. Orthostatic hypotension. Rationale:
Postural hypotension reflects reduced intravascular volume. Question 39. Which electrolyte imbalance increases risk for digitalis toxicity? A. Hypokalemia. B. Hyperkalemia. C. Hyponatremia. D. Hypercalcemia. Answer A. Hypokalemia. Rationale: low potassium enhances cardiac sensitivity to digoxin. Question 40. Which fluid is considered hypertonic? A. 0.9% NS. B. D5 1/2 NS. C. 0.45% NS. Or D. Lactated ringers. The answer is B. D5 1/2 NS. Rationale: hypertonic fluids draw water out of cells into circulation. Question 41. The nurse expects which symptom in a client with hypercalcemia? A. Muscle twitching. B. Positive Trousseau's sign. C. Constipation. D. Tingling around mouth. The answer is C. Constipation. Rationale: calcium excess reduces GI motility. Question 42. A patient with serum phosphate level 2.0 milligrams per deciliter likely also has A. Hypocalcemia. B. Hypercalcemia. C. Hyponatremia. D. Hypermagnesia. The answer is B. Hypercalcemia. Rationale: calcium and phosphate have an inverse relationship. Question 43. Which intervention prevents air embolism during central line removal? A. Inhale during removal. B. Exhale and bear down. C. Take deep breath and hold. D. Sit upright. Answer: B. Exhale and bear down. Rationale: Valsalva maneuver increases intrathoracic pressure, preventing air entry. Question 44. Which finding indicates fluid retention? A. Weight loss. B. Decreased BP. C. Peripheral edema. D. Weak pulse. Answer: C. Peripheral edema. Rationale: fluid accumulation in interstitial spaces causes swelling. Question 45. A patient with serum osmolality of 370 milliosm per kilogram likely has what? A. Overhydration. B. Fluid overload. C. Dehydration. D. SIADH. Answer: C. Dehydration. Rationale: elevated osmolality reflects concentrated plasma and water deficit. Which electrolyte imbalance causes increased taste and dry tongue? A. Hyponatremia. B. Hypernatremia. C. Hypokalemia. D. Hypercalcemia. Answer: B. Hypernatremia. Rationale: high sodium levels triggers thirst and dehydration signs. Question 47. A patient on lithium therapy has serum sodium of 128 milliequivalents per liter. What is the concern? A. Lithium toxicity risk. B. Hypocalcemia. C. Fluid overload. D. Hypokalemia. Answer A. Lithium toxicity risk. Hyponatremia decreases lithium excretion, leading to accumulation. Question 48. Which lab result confirms dehydration? A. Decreased hematocrit. B. Increased hematocrit and BUN. C. Decreased BUN. D. Decreased urine-specific gravity. Answer B. Increased hematocrit and BUN. Rationale. Fluid loss concentrates blood components. Question 49. Which client statement indicates understanding of potassium-rich diet? A. I'll eat more oranges and bananas. B. I'll avoid leafy vegetables. C. I'll drink less milk. D. I'll eat more bread and rice. Answer A. I'll eat more oranges and bananas. Rationale. Bananas, oranges, and potatoes are rich in potassium. Question 50. A nurse caring for a patient receiving IV calcium should monitor A. Neurologic reflexes. B. Cardiac rhythm. C. Urine output. D. Skin turgor. Answer B. Cardiac rhythm. Rationale. Calcium affects cardiac contractility. Monitoring prevents dysrhythmia. Congratulations on completing this 50-question fluid and electrolyte Nclex review. If you made it to the end, you've just reinforced some of the most critical topics tested in nursing exams, from sodium and potassium balance to acid-base shifts and fluid therapy. Now it's your turn. Comment your score below. How many out of 50 did you get correct? Stay tuned for the next Nclex challenge on acid-base imbalances and fluid management, coming up soon. Keep practicing, keep improving, and remember, mastery of fluid and electrolyte balance saves lives.